Hi, I'm Dr. Greg McDonald. I'm a veterinarian in Southern California, and we're going to talk a little bit about dog health today. I wanted to talk about diabetes in the dog. Diabetes is a disease that's not uncommon, but we do see it every once in a while in the dog. Dogs get this, and it's an abnormal amount of glucose in their system. And what happens is that their pancreas is not putting out enough insulin to keep the blood glucose in a normal range. Normal range would be around 120. And these dogs that come in that are drinking tons of water and urinating a lot, their glucose levels can be up 300, 400. I've even seen them as high as 500. And those dogs are in trouble, and they need to get treated right away, or they can actually die of that. So dogs get this because their pancreas, for unknown reasons, has just stopped making insulin, and then that allows the blood sugar to get high. Oftentimes these dogs will be drinking a lot and then urinating a lot, and we'll even find some glucose in their urine because, again, the threshold for glucose in the renal threshold gets a certain level, and then the glucose starts to spill into the urine, so you can actually catch this on a urine test sometimes. The way we diagnose it is to use this little machine that we have that will actually tell us what the blood glucose level is. This little machine is really nice because it does one step at a time with just a very small amount of the blood from the dog. And we take and put a little strip into this area here, and it reads out over in this area here exactly what the blood glucose level is. So usually we pick this up on a regular screen. An animal comes to me that's drinking a lot of water is what the owners notice first, and we'll do a regular panel. There's probably about 12 different diseases that we have to find out if it's caused by these other 12 diseases or this happens to be a blood glucose problem. Once we diagnose it as a blood glucose problem, we start giving the dog insulin, and most dogs do require a shot in the morning and a shot at night. This is the product that we like to use now. It's called Vetracillin. We actually train the owners to give a subcutaneous injection, and we actually start out at a certain level, and when we retest the dog after about a week and see if the insulin is taking effect and keeping the blood sugar in a normal range.